Hi, I'm Darwin, and this is my video discussion post for week 1 in PTA 226 Physical Agents Lab. I'll be trying to recall two topics. The first one is edema. Edema is a medical term for swelling. Let's say, for example, I injured my arm, the left arm, this one. So I fractured it and it became swollen. It got bigger. So that is edema. It is a sign of inflammation. It is a not normal response of our body to injury. The reason why it's big is because there's an increase in the amount of interstitial fluid, which is either diffused or localized in this area. So how do we measure this edema? How do we evaluate the edema? So we could look at them visually and compare the the site where there's edema and the one which is normal. We could also use a measure the circumference by a tape measure. So we just wrap around the tape measure here, measure the circumference, move a couple of inches down, all the way down here, and get the data and compare it with the right hand. Another way of evaluating edema is by using a volumeter. Amount of fluid displaced when you put your hand, one hand, in a container with water and with measurements. So it displaces water. So we compare the water displaced by the right hand, by the left hand and the right hand. So what are the ways to reduce edema? There are several ways. One is by elevating the part of the body that has edema, and you have to make sure that it's above, raised, placed above the heart. We could also use compression garment, cold pack, and retrograde massage and mobilization. The second topic that I'm going to be discussing is about the use of hot pack. What is hot pack? This is for, and how do we use it? How hot should it be? A hot pack should be between 71 to 79 degrees Celsius. It has to be kept in a hydrocollator, which is 165 to 70 degrees hot. Hot pack is a type of superficial heating agent, which is used to help in wound healing. What it does, it is elevates the tissue temperature and increases blood in that area. So that's how it helps in wound healing. And it also contributes to alleviating pain and pain management. How do you use a hot pack? Let's say this is the hot pack. We cannot use it directly on the patient's skin. There has to be 6 to 8 layers of towels in between the hot pack and the patient's skin before we use it. So normally we wrap it first with a terry cloth. A terry wrapper comes in 2 to 4 layers. So let's say, for example, this is a terry wrapper. So we wrap the hydrocollator. So now we got 2 layers on both sides, each side, so we know we need 4 more layers. So we get a towel and then we wrap it like so. So now we got the 3rd layer, we got the 4th layer, we got the 5th and the 6th. Now that you have the 6 layers of fabric, we go to our patient and apply it on the back where the pain is present. And it's got to be applied for 15 to 20 minutes. And the first 5 minutes, you have to make sure to check it because that is the time when the most intense heat is being transferred to the skin. And so we have to make sure that the patient is not getting burned